Now we will start with simple interrupted suture, which is the most common type of suture used for flap closure. Simple interrupted suture is a 2-point suture. Now let's start. We will take the first bite from the outer surface of the first flap. Continue to exit from the opposite side. Pull the needle along its curvature out of the tissue. Now, again, identify the V shape formed by the long end of the suture and the short end of the suture in order to start tying the knot. Surgeon knot is tied by intertwining the suture twice around the peaks of the needle holder, grasping the short end of the suture, pull it out in the opposite direction. Again, the long end is intertwined once, short end is grasped by the needle holder and pulled in the opposite direction. A surgeon knot can be further secured by a third throw, again in the opposite direction. And this is the resultant knot. Now, we will cut the suture about 2 to 3 mm for subsequent retrieval.